Guys, welcome to our channel. Today we have a very important discussion to do, and I'm glad that we have Victoria with us. Many of you have been asking about Kimber Health insurance since we shared it on our channel about some of the benefits that international students can get from it. So I'm glad that we can get someone from Kimber Health to explain all the details and all that we need to do, especially for students who pay huge sums of money in insurance. I recently enrolled on Kimber Health and it has really been helpful for me, and I'm on my OPT, so as many of you are aware, I qualified, and recently Danny told me about it and I enrolled in it. So if you look at my spectacles, I got it for free through the insurance because it was really expensive. Some of the spectacles I used in the past, it cost a lot. So I'm glad that we could have Kimber Health with us. So stick along and let's get into the video. Hello, Victoria. Welcome.
Hi, Alfred. Thank you so much for having me.
Yeah, thanks for your time. I'm happy that when you reached out, you were willing to have a conversation with us. So we are happy you are here. Many students have been asking about Kimber Health insurance, and some have specific questions about the school that they have, waiver questions, issues about immigration. People ask if it is genuine, and for me, because I've gone through the process, I know it's genuine. So we wanted to bring you here so that if you can take us through some of the things that Kimber Health do and how students can benefit from it.
Yeah, absolutely. Well, as you said, healthcare is extremely important in the US and it can be very costly. And we do get a lot of questions, including what you just mentioned, which is, is it legit? How does it actually work? And for our flagship program, which is entirely free, where's the money actually coming from? So I'm glad that you've been able to benefit from it, and I do like your glasses.
Thank you.
And I think, in a moment we'll go through a quick presentation that I put together. Hopefully that will explain some of the questions that a lot of students have.
Yes, I think that will do. And after I have some few questions here, if you answer them through the presentation, then that will be fine. If not, I have some questions that some students ask me. I would want clarification about it from you. And so if you can take us through the presentation, that would be awesome.
Yeah, sure thing. Then in that case, let me share my screen. Okay, can you see this?
Yes, I can. Beautiful.
All right, okay. So we're going to start with our tagline, which is healthcare is a right, not a privilege. Our mission as Kimber Health is to make sure that international students and refugees coming to the US know what healthcare options are available and that they are paying, minimal costs for good coverage here in the US. So let's talk about our impact very quickly. We have applicants from over 100 countries at this point. I think we have 107 last I counted, so that's something that we're very proud of. We were the second largest agency for United Healthcare in 2021, and in 2022 we became the largest.
Wow.
We held that title in 2023 as well. Thank you very much. And our mission I went over briefly earlier, but we're here to make sure that people coming to the US know what healthcare options are available. So let's do a quick product overview. Pretty much we separate people into two different categories. If they are in New York and over 21, we have the flagship program. It is a free health insurance program, which means it is entirely no cost. There's no cost to apply, no cost to use the insurance. We don't charge anything at any point, and I think you may have experience with this. And for everyone else, so New York residents under 21 or anyone outside of New York, we have affordable plans, and I'll go through the distinctions and the benefits of all these programs in just a moment. Okay, so for the Essential Plan, this is our flagship. This is the one that you got your glasses from, and it's really an incredible program. It's something that I used when I was in college as well. I went to NYU and I was able to waive off my insurance, which was around $4,300 when I was in college.
Yeah.
So it was $4,300 that I was able to put back in my pocket.
Yeah, at Yale I was paying about $1,300 for a semester. So the whole year would be, so if I add the summer, then I'm looking at about around $3,000 to $4,000 as well. Yeah.
It's incredible. I've seen $3,000-$4,000, like you said. I've also seen some colleges that charge $6,000-$7,000. So students are paying a lot for insurance, and it's good for them to know what other options there are.
Yeah.
All right. So for the essential plan, you get free dental and vision care, which is incredible. So glasses, which we've gone over many times, and also if you need to get your wisdom tooth removed, you want dental cleanings, you need a tooth filing, root canal, whatever it is all covered under this plan. You also get free PCP care, free preventative care, free ambulances. So we've heard, some students say that they actually need to call their insurance company in the event of emergency and make sure that their insurance covers the ambulance.
Yes,
before they call it, which is incredible.
I actually didn't know that ambulances charges are different from your healthcare bill until when my daughter fell sick and we have to call the ambulance, and after after everything, we receive a bill of over $6,000, and we're like, really? So ambulance can really be expensive. It's not cheap. It's not for free when they are already always available to pick you up. It's really expensive. You are right.
It's incredible. That's why so many people order Ubers instead in an emergency. Not that we recommend this, but ambulance charges are fully covered under the essential plan. You don't need to call anyone. Just, dial 911 if you are having an emergency. The ambulance will come pick you up. They'll take you to the nearest hospital. Don't worry about the bill. Everything is covered entirely. So this is really an incredible program. And we also get a lot of questions about prescriptions, mental health care. These are both covered in full as well. So if you're looking to, if there's like a medicine that you're usually taking every month, that can be covered entirely at no cost. Same with mental health care. And there are two more things.
Go ahead. I'll ask my question after, so go ahead, please.
Okay, I'll try to be quick then. I think there are two other things that people really like about this program, and the first is going to be our $300 grocery card. So in addition to getting free health insurance, you get kind of a debit card on top of that. It's charged with $300 each year, although they give you $75 per quarter. So 4 quarters in a year, 75 times 4 is $300. And what it does is it actually takes $75 off of your grocery bill or your CVS, Duane Reade bill. You can take this debit card, go to Walgreens, Walmart, Duane Reade, CVS, buy your items. They have to be household items or they have to be healthy items. So you can't use this to buy, like tobacco or alcohol. You need to actually be buying, things that are used in your household or good for your health. You scan them at the checkout, and then you also scan this card, and it just deducts from that balance. So if you have a $30, grocery bill, then it deducts the whole thing. You don't pay anything.
Awesome. Yeah.
So that's one thing, and the other thing is going to be the gym membership reimbursement. That's also very popular. So I know you and I were talking about this last time for the gym membership, but how it works is if you go to the gym 50 times within a 6-month period, you get up to $200 back. And if you do that twice in a year, then you get up to $400 back.
Yeah. And
there's a procedure that you have to follow. There's a form that you have to fill where you say, okay, these are the dates that I went. They want to verify that you actually went 50 times. You have a gym employee sign it, and then you attach your receipts. You mail it in. Once they approve it, they send you a check back for however much it is that you paid.
Okay. Awesome.
Yeah,
so,
absolutely.
I have a colleague who is pregnant and she wanted to ask, does this insurance cover maternal care as well?
That is a fantastic question. So actually starting April 1st of this year, maternity, delivery, that is all covered. The only thing that we need is as soon as a member knows that she is pregnant, please let us know what the due date is. That way we
Okay.
can add the unborn baby into the system,
Okay.
and the delivery itself, which is usually the most expensive part,
Yes.
will also be covered.
Will be covered. Okay. Okay. What about braces? If somebody wants to get braces for whatever reason, to hold the teeth or to solve any medical problem or to close the teeth gap and all that, does this essential plan also covers it?
Unfortunately not. Braces are considered sort of aesthetic rather than medically necessary. So there are certain cases where if you can get a doctor's note, if they can prove that it is medically necessary for you to have braces,
Yeah.
then it's fully covered. However, most people consider braces to be more of an aesthetic treatment. So similarly to how plastic surgery isn't covered, braces are also not covered.
Okay. All right. Thank you.
Yeah, of course.
So this essential plan are for those in New York State, right?
Yes, that is correct.
Okay. Thank you.
Actually, let me talk about the eligibility requirements in a moment. I'll go back to this.
Okay.
So there are pretty much 3 requirements that you have to keep in mind. The first thing is that you need to live in New York. This is a New York plan, so you have to actually live in New York to qualify for this. The second, you need to be above the age of 21. And the third is that I'm sorry, there are actually 4 things. Let me start over. So there are 4 things that you need to keep in mind. There are 4 things that you need to keep in mind to actually qualify for this plan. The first thing is that you need to be in New York. You need to live in New York to qualify for this. The second thing is that you need to have some sort of valid visa status.
Yeah.
So that could be F1, J1, OPT, or you could also be a green card holder or US citizen. The only thing is that for green card holders and US citizens, it gets a little bit more tricky. So if that's you, I would say reach out to us. We'll see if you qualify. We generally work with a lot of F1 students.
Yeah.
If you are an F1 student, you need to be above the age of 21 and also younger than 64. And your annual income needs to be below $37,650 in fiscal year 2024.
Awesome. Okay. So what about visitors, those who are coming on a visit? For example, if my sister visits me in Rochester, I'm in New York, and she's staying in New York, let's say for the next 3 months, and her visa allows her to do that. Is that also, will she also qualify for this package for the essential plan?
Yeah, that's a great question. So B1, B2 holders also qualify for this.
Okay.
I think the general rule of thumb is if you have a visa status that is a letter followed by a number, so it could be F1, B1, could be K4, you would qualify for this.
Okay. And finally, I have a question here. If you say New York resident, what do you accept as a proof of residency?
So generally, the system will just ask for a valid New York address. We ask for it in our application. Just put in your New York address and make sure that if you have an apartment number, to include your apartment number. In very, very rare cases, do they actually ask for some sort of proof, so a lease or a bank statement going to that address. I think maybe 1 or 2% of cases. So generally, we just need a valid address where the New York State can send you your mail, where we can send you your insurance card, and that's good enough.
Okay, yeah. I think when I was applying, I was only required to put in my address. They didn't ask of any lease or any ID. So, yeah. Okay, thank you. I think we can go ahead.
Yeah. Okay, all right. So one question that we get very often is, will the essential plan actually affect immigration status? I know that there's a lot of kind of concern flying around about, taking government money. Is it going to actually affect any application for green card in the future? I know that a lot of international students are concerned about this. So we've done a lot of research. We've spoken with immigration attorneys. We've also spoken with Max Hadler, who is the Director of Immigration at the New York City Department of Health. So it really doesn't get, any more legitimate than this.
Yes.
He is the Director of Immigration and Public Policy. So we took a video where we interviewed him, and I can just play the tail end maybe?
Sure.
He talks about immigration?
Yes.
Okay.
My name is Max Hadler. I'm the Director of Policy and Immigrant Initiatives in the Healthcare Access and Policy Unit at the in the Essential Plan to an application for permanent residence.
Is my immigration status right now or in the future when I'm on the track for the permanent residency?
No, there's no impact of enrolling in the Essential Plan to an application for permanent residency or to any other immigration-related application, which is why we encourage everyone who's eligible to enroll, and everyone should enroll in the benefits. If they are New York State residents and they meet the income requirements for the Essential Plan, then certainly international students, among many other people, can enroll in the Essential Plan.
Awesome.
I'll play the full thing. It is a few minutes long.
Yeah. Thank you.
So that resource is also available on our website, just in case you want to watch through, see the other things that he says about why the Essential Plan exists. Oh, one thing that I should talk about very quickly.
Yeah.
A lot of people will ask us, why is it actually free?
Okay, yes.
Especially when we're giving out the $300 grocery card and, everything is covered entirely. A lot of people want to know, who's actually funding this? Why is it free? And it's a very simple answer, honestly. It's sponsored by the New York State. So New York State created the Essential Plan to make sure that the people living in its borders are covered entirely. They wanted to make sure that those with lower income, so you need to have under $37,650
To qualify, yeah.
of income to actually qualify for this. So they want to make sure that those with lower income within the New York State borders get access to free and comprehensive coverage.
Awesome.
All right, so I'll keep going.
Yeah. Can you make it a little bigger?
Sure thing.
Yeah. Yes.
Is that better?
Yes.
Okay. Oh, I'm sorry. I should have done that earlier.
No, it was bigger earlier, so you're okay.
Okay.
Yes.
All right. So let's keep going. There are a lot of numbers I'm going to throw at you, so I'm going to try to skim through. If you have any specific questions, I think I can go back and cover it. Outside of New York, we have a lot of different programs. So in order to determine which program you actually qualify for, I would recommend going to our website because we match up the appropriate program for you based on your college, your age, and where you're living. So I'll go through all the different options, but ultimately to figure out what actually works for your university, I would say go to our website to make sure.
Yeah.
So we get coverage through the United Healthcare PPO, and in case you didn't know, the PPO is actually this sort of network of doctors that you have access to.
So, yeah.
Yeah. So we use the United Healthcare PPO, which is one of the largest networks in the country. So you know that it will be easy for you to find a doctor, a specialist in your area that will take your insurance. And the pricing starts from $412, goes up to $2136 per year. It does get a little bit more expensive depending on your age. Generally, the older you are, because older individuals tend to have more health conditions, health services that they need access to. It will also be a little bit more expensive. So we'll talk about the most affordable plan first. This is the Chromo plan. And this one starts at just $412 per year. This really is a program that is suitable for those who feel like they are healthy, who really just want to maximize their savings. So we hear from students from colleges who accept this plan that they really just want to, put all that money back in their pocket. They feel like they don't really need very comprehensive health coverage, and so that's usually when they opt for this program. So it is our most affordable plan. And the second is going to be our Royal Series. This one has a pretty good range of coverage. It's also accepted in quite a lot of different universities. So we have 3 tiers. We've got the Royal Plus, Royal 100, and Royal 1500. You can see that it ranges from $919 per year up to $1843 per year. And the range in pricing corresponds directly to, the amount of coverage that you will receive. So 1,500 is going to be those who want to maximize their savings.
Yeah.
Royal Plus is going to be for those who want to maximize their coverage. And Royal 100 is kind of a happy medium, I think.
Yeah.
So I think generally a lot of students like to go with the Royal Plus plan. It does provide quite comprehensive coverage, and I know that especially for new students who aren't really sure about what's available out there, they do want to make sure that they get comprehensive coverage, and so they'll kind of opt out of their university insurance plan, get this one, and I suppose rest easy, knowing that they have a plan that is at least equal to or even better than their university plan.
Yeah. So can you briefly explain what deductible means? Because I see some having 1,500, some 1,000, and some 0. So that students will be aware which one, what it means when they are signing up for this. Briefly.
Sure, absolutely. So every health insurance plan that you see has something called a deductible. Deductible is the amount that you have to pay before your insurance kicks in. So for Royal Plus, when it's a $0 deductible, that means it's just automatically active. You don't need to pay anything.
Okay.
For Royal 100, if there's a $100 deductible, then let's say you go to the doctor and they give you a bill that's $150, then you need to pay the $100 first, and then the remaining $50, it just depends on your co-insurance and the details within your policy. It depends on what kind of medical service you're getting.
Okay.
So every plan has a deductible. With your university plan, you can also go into the policy details and see what that deductible is.
Yes, okay. All right. Awesome.
Yeah, absolutely.
Mm.
So I think it's kind of difficult to talk about these in just by laying out the details. It's probably better to compare them side by side with a university plan. I think, to me, that makes a little bit more sense.
Yeah.
So as I said earlier, I was an NYU student. That's why I pulled out the NYU details over here, and I can quickly compare the differences between our plans and the NYU plan. So, NYU, please don't come after me. But yeah, so for NYU, most students are paying $4,300 per year. I think this year they actually dropped it to $4,100, which is great for the students, but it's still, $4,000 each year that you're paying for insurance. So you've got a $0 deductible, which, as we stated earlier, means that you don't need to pay anything before your insurance kicks in. You have a $73.50 out-of-pocket maximum. So out-of-pocket maximum is exactly what it sounds like. It is the maximum that you have to pay out of pocket for health services in that year.
Yeah.
So they make sure that there's a cap on how much you're actually, paying out of pocket. And I guess it's just like an extra assurance.
Yeah.
There's an unlimited maximum benefit, which means that the insurance company will never stop paying out for health services. For some other plans, you'll see that there's,
limited,
50,000 cap, 250,000 cap, which means once they get up to 50,000 or 250,000, they will stop paying. Yeah. There's also 100% co-insurance, which means that that means 100% of the medical service costs are covered after the deductible. So if you get a bill for 1,000, presumably they are going to cover 100% of that bill.
Okay.
Yeah. You'll see 80% sometimes, 75% sometimes, which means that they would be covering $750 or $800 of that $1,000 bill. So as with most university plans, dental and vision is not covered, and that is the NYU plan, just in broad strokes. And then over here in the middle we have the essential plan, which is our flagship free health insurance plan. So obviously, the premium is $0, which is a lot better than $4,000. Deductible again is 0, and you can see it's 0 across the board for the essential plan and for the Royal Plus plan. The out-of-pocket maximum is $0, which means you are paying nothing out of pocket for health services, which is why the essential plan is such an incredible program. Unlimited maximum benefit across the board, 100% co-insurance across the board, and for the essential plan, dental and vision is covered. For the Royal Plus plan, the annual premium is $1,843. the out-of-pocket maximum is $6,000, which is better than the $7,350 provided by NYU. So I guess just broadly speaking, you can see that the Essential plan is much better than the NYU plan. And Royal Plus is pretty much comparable, if not a little bit better than NYU's plan. Hopefully that wasn't too much information at once. I feel like I'm rambling.
No, I think
just
that's very useful. So, yeah, that's very useful. Thank you. So,
Yeah, of course.
do you have any other thing, or I can go on and ask my question?
Let me just skim through very quickly
Yes.
through the last two slides, and
Okay.
then I promise I'll get to your questions.
Yeah, okay.
So we've got the World Elite series. This is also quite popular because a lot of schools require something called ACA compliance. So ACA refers to the Affordable Care Act, which laid out certain requirements that your insurance needs to match. So these World Elite series insurance plans were actually filed and approved by the Center for Medicare and Medicaid Services at the federal level in the US, meaning that they are entirely ACA compliant. So we've got 3 different tiers, kind of similar to the Royal plans, and you start with World Elite 450, and you go up to World Elite Plus. And you can see the differences in deductible, out-of-pocket maximum, maximum benefit, as well as co-insurance. But I think it probably makes a little bit more sense to actually compare it to a university plan. So
Yeah.
we've got Stanford's plan over here. Stanford students are paying $7,000 each year for insurance, which is insane.
It's a
Compared
lot.
to the World Elite, it's a lot.
Yes.
Compared to the World Elite plan, which is only $2,000. So right off the bat, you can see the deductible is higher for Stanford versus the World Elite plan, which is $0. The out-of-pocket maximum is slightly better for Stanford's $4,000 versus $5,000. Unlimited maximum benefit, but the co-insurance is kind of where they get you. So for the Stanford plan, it's 70 to 100% co-insurance. Depending on the medical service, they may cover only 70% of that bill. Whereas for the World Elite Plus plan, they cover 100%. So you can see that the World Elite Plus plan is at least comparable, if not a little bit better than Stanford's plan.
Wow.
And I'm not sure who's going for their bachelor's, but if you're, going for your bachelor's at Stanford, then over the course of 4 years, you're saving pretty much $20,000.
That's a lot of savings.
Yep. And this is something that a lot of students don't really know about, or it's something that they don't really think about, but it's a way that you can save, a few $1,000s just by spending 15 minutes working on your insurance and waiving it off. Final thing is going to be the OPT plans. So a lot of times students will graduate and then they'll say, okay, now what? I don't have coverage through my university. I might not have coverage through an employer just yet. What do I do? So we have the OPT plans. They are quite affordable. They start at $383 per year. And here are the program details. I'm not going to go through every single line.
Yeah.
But you get, some pretty basic coverage at a very low cost. So this is just for kind of your peace of mind. And then in terms of the process, so for the Essential plan, it takes about 5 to 7 business days for us to complete the process of signing you up for the plan. It takes a while because we actually have to get everything from you, pass it over to the state, and then they have to, check all the boxes, come back and tell us, congratulations, you have free health insurance. So it does take some time. And after 5 to 7 business days, we'll come back and we'll say, congratulations, you have free health insurance. After which, pretty much within 48 hours, you can access your online account and get a virtual insurance card. If you want to wait, you can also give it another 2 weeks or so, and you will receive a physical insurance card in the mail. So that's for the Essential plan. And then for the affordable plans, it's very quick. We don't have to go through the New York State or anything. All you do is go onto our website, pick your plan, pay the fees, and then the insurance card will be sent to you via email in pretty much 2 to 3 minutes. So it's very quick. I can go over this very quickly. So I think why Kimber Health excels is because we have actually personalized and multilingual service. We know that a lot of international students might not speak English as a first language, and so our customer service team speaks, I think, 5 or 6 different languages at this time. We also have quite a good range of insurance programs. So every year we spend 2 to 3 months just sitting down, looking through all the different insurance plans that are available, looking through all the different university requirements that are out there, and we make sure that we pick the best plans for the students at a select university. So we spend a lot of time just doing research, making sure that you have the best plan available. And I think our experience also makes us stand out. I think there's probably a reason that we were the top agent for United Healthcare in 2022 and 2023. But if you don't believe us, I don't know, you can try it out for yourself. You're always welcome to contact us, and we'll see how we can help you.
Awesome.
And just to wrap up, here are some of our major partners. So we are an authorized partner of the New York State of Health, which means we are entirely licensed. We are partnered directly with the state program that provides all of these different health insurance programs. We're also partnered with United Healthcare, Fidelis, and Emblem, which are major insurance companies here in the US, as well as nonprofits and language centers. And that's pretty much it.
Wow, thank you. Thank you. So let me ask briefly. So one of the key questions we've been receiving from students who watch our video is that sometimes they can't access their schools in the system when they are going through the process. In your system, what advice will you give to them? And also, some schools do not have waiver policies, so it's like you basically can't do anything. Do you have any advice, or how should they go about it? Because we've had a lot of those questions.
Yeah, that would be a little bit tough. There are universities out there that don't accept any plan for waiver. In which case, our hands are kind of tied. We don't want to promote a plan that you can't use to actually with your university plan with. So the ones that we have verified, we have on our website. If you're not too sure, you can contact our customer service. We can match you up with a plan, and you can give it a shot. And if it doesn't work, then we can provide you with a refund.
Okay. All right. And for those in New York, I think if someone already has a school that is not willing to waive the insurance, right? But the school have limited offers, for example, dental and vision, as we saw in NYU, assuming I am in NYU, and NYU is not willing, I'm just making an assumption, it's not willing to waive the insurance. Can I still sign up for Kimber Health knowing that I'm in New York State and it will be free for me, and use that to afford, go to hospital or to access healthcare instead of what my school provides?
Yeah, so that's a very popular option. In fact, a lot of students will get the free health insurance program to kind of supplement their university coverage. So as you mentioned, there's free dental and vision care with the free health insurance, and a lot of students will say, okay, I'm not getting it through my university, so let me get it through this free health insurance program. In fact, that's what a lot of NYU students are doing this year. So NYU made a change last year in which they are no longer accepting the essential plan for waiver, which means right now we are recommending that they waive off with one of our cheaper plans.
Yeah.
Once they waive it off, they can also get the free health insurance coverage.
Oh, that's a smart plan.
Yeah.
Okay, so thank you so much, Victoria, for your time. If you have any question, I think we will leave your email, your website, and all the details to your customer service in this video description section, so that students or people who are interested can reach out and ask their questions. And once we also get any concerns that people want to know, we will reach back to you and see what you think. Thank you.
Absolutely. Thank you so much for having me here.
All right. Do have a good day. All right.
Thank you. Bye.